Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, in the gonioscopy, we have to see the grading of the anterior chamber angle. So, this grading of anterior chamber angle is based on the von Herking's. That is, von Herking's grading is from the iris to the corneal angle separation. The grading is seen. So, we have grades, the following grades. First, we have grade 4. In grade 4, there is wide angle. So this is based on von Herrich's iris to corneal angle separation. So the angle can be divided into 5 grades. So grade 1, grade 4. So from ascending to descending order, grade 4, there is widely open angle is seen on grade 4. In the grade 4, there is iris to corneal angle separation is seen, which is of 35 to 45 degrees. Iris to cornea angular separation is seen from 35 to 45 degrees. This is wide open angle, that is grade 4. Then we have grade 3. In grade 3, we have moderately open angle where the iris to corneal angle separation is between 20 to 35 degrees. So if it is 30 to 45 degrees, then it is grade 4. 20 to 35 degrees, then that is grade 3. Then in grade 2, there is moderately narrowed angle where iris to corneal angular separation is 20 degrees. Then in grade 1, we have extremely narrow angle with iris to corneal angular separation is 10 degrees. In grade 0, we have closed angle where iris to corneal angle separation is 0 degrees. So this is the angle, iris angle to the corneal angle. This angle is what we are calculating in the grading of anterior chamber.
thank you and thank you for watching.